Hello, I'm Charles, and I go by the round mound of Zepbound. Welcome to my channel. Now, it's been a while since I've given an update on my prostate cancer treatment. I think my last update, I had just gotten the markers and the spacers placed in preparation to start the treatment. The week after that, I had to go back in so they could align the machine to my dimensions to properly beam the radiation. Part of that involves them giving me a little tattoo, one on each hip, to ensure that there's accurate positioning during the treatment. They kind of line you up on the table based on where those tattoo marks are. Well, as of yesterday, I've completed 6 weeks of treatment. That means I have 3 more weeks to go. What has not been lost on me on this journey is everyone that I'm sitting in the waiting room with is at least 15 years older than me, if not older. I started this process when I was 49. My doctor ordered a PSA test. I was just a few weeks away from being 50. I'm 50 now, a few months away from being 51. And as I'm sitting in the waiting rooms and I'm interacting with some of the guys, a lot of them are much older than me. So it kind of gives this impression that this is an old man's disease. And that was my thought process as well. This is something that you get when you get older, and I'm not old. I may be old, and I guess that's relatively speaking. I may be old to someone, but I'm not old. I'm just 50, and despite being a grandfather at 50, I feel pretty young, especially since I have lost all this weight. And when I was actually going through the process of getting the markers in the space place, the doctor made a comment, you're 50, what are you doing in here? And I replied to that, yeah, that's what I was thinking. You have to change your mindset that this is not an old man disease. I mean, we need to start getting tested for this cancer, some of us at the age of 45, and stay on top of it from there. As far as my treatments have gone, they have been generally fine. The actual treatment takes about 7 minutes or so. You lay on the bed of the machine. They do a scan of your body to ensure that 2 things exist. 1, that your bladder is full, and 2, that your rectum is empty and you don't have any gas in your body. And it's necessary to have a full bladder because it pushes the small bowel up and away from the treatment areas to ensure accuracy. And an empty rectum ensures that the rectum is out of the radiation field. So you kind of do this dance, and that's kind of the hardest part of the whole treatment. You want to ensure that your bladder is full, but it can't be too full. And if it is too full, you have to empty some of it. And if it's not full enough, you have to sit around and wait until it's full. And if you don't get it in time, they may have to cancel your appointment and have that appointment rescheduled. That happened to me once. So I have an additional appointment after when my treatments was supposed to end to make up for that one missed treatment. And my appointments are currently at 8:10 in the morning, every morning, Monday through Friday. So I'm drinking about 80 ounces of water and a 12-ounce protein shake between 6:30 and 7:50 a.m. just to make sure that my bladder is full. And I'm slamming a lot of liquids in that little time frame. Now, the machine itself is interesting. It's kind of like a hybrid CT scan machine that emits radiation. This part of the machine is the treatment head. It rotates 360 degrees around your body while you're laying on this suspended table, and it focuses in on those markers that they install into the prostate in order to pinpoint the treatment into the prostate. My radiation dose is 180 centigrade per session. This is what is called a conventional fractionation. What conventional fractionation means is I have a prescription for 8,100 centigrade. I receive that in daily fractions. So 180 centigrade doses per session across 45 sessions to get to that total of 8,100 centigrade. Mostly my side effects have been a bout of fatigue, but starting last week, I started noticing urinary flow became real diminished. I can feel like a dam is about to burst, and I can only trickle out a little bit at a time. So it takes longer to empty my bladder. Sometimes I have to stop and start a lot. I may have to stop and then come back 10 or 15 minutes later to get my bladder completely empty because of the way that's going. I meet with the oncologist every Tuesday. The oncologist prescribed for me Flomax for that. And I started taking that on Tuesday of this week. And so far, it has helped. My flow is not back to where it was, but it is better than what I had been experiencing. So I'm thankful for that. And hopefully, as I continue to take the Flomax through this treatment process, it will continue to flow. And then once I finish treatment, I hope that it will completely rebound or get something close to where it used to be. Now, another side effect that I've been dealing with because of the radiation is radiation burn. This is due to inflammation of the bladder lining in the urethra. It is expected to improve at some point after I stop treatment. Fingers crossed for that. In the meantime, the oncologist told me to get this over-the-counter medication called Azo, and it's a urinary pain relief. That started working right away. She told me that it would turn my urine orange, and I kind of forgot about that. I picked it up that evening, and I took the first 2 pills that evening, and I had to go to the restroom afterwards. And I'm standing there looking down into the toilet, and I'm thinking, "Damn, am I dehydrated? Because this color is weird." And it immediately hit me. Oh, I had just taken those pills, and that is why it looks that way. It kind of looks like Sunny D. It's real funny looking. It's different. So additionally, for the last 3 to 4 weeks, I've been dealing with radiation-induced constipation, and it happens like clockwork. I'm generally fine Saturday through Monday morning, and that is reflected in my weight those days. But I get my first treatment of the week on Monday morning, and the constipation kicks in on Tuesday, and it follows me through Friday. I mean, I am doing some emptying, but I don't feel like I'm doing a full release all the time. So I have been doing Marilax and Mago 7 daily, and they seem to be helping some, but not to the extent that I need them to be. So I'm trying to mitigate that with using magnesium citrate. That has been mostly successful, and I just basically do half a bottle on Tuesdays and Thursdays to kind of keep things moving at a comfortable or reasonable rate. And along with that, I think I'm also retaining a lot of water because of and I don't know if that's because of the radiation or because of the amount of water that I'm taking in each day, because I'm doing 90 fluid ounces for between 6:30 and 7:50 in the morning, and then I have to continue to drink throughout the day. So I don't know if the radiation is causing me to hold on to that water more than I would have, or I'm just not emptying enough. So, and as I go through the week, I can see that reflected in my weight loss. It goes up Tuesday through Friday, and then comes down Saturday through Monday. So I really find that interesting. So that is where my treatment stand at this point. Like I said, I have 3 more weeks to do. Once done with the treatment, I will need to do a PSA blood test every 3 months for the first year, and then after that, it's every 6 months thereafter, to ensure that there is no return of PSA into my bloodstream. So, as a reminder, if you are a black male, or if you're a male of any race that has a family history of prostate cancer, you need to start getting a PSA test at the age of 45 at a minimum. For us black men, we are 80% more likely to get prostate cancer and twice as likely to die from it. And I think that dying part of it is related to us not going to go see the doctor. So get out there, get to your doctor. If you have insurance, the PSA test is free. It's just a blood work test. So there's no reason for you to not get it. So now on to my week 64 update. This was my 4th week back on branded medication, Zepbound to be exact. It was also my 3rd week back on the 10 milligram dose. This week was the best week yet in terms of feeling the fullness and food noise suppression. It took a little more than a day to kick in, but once it did, things felt normal for me like they had been in the past. And when I weighed in at the completion of week 63, I had weighed in at 203.1. Some of that was driven by constipation related to my treatment. Some of that was related to water retention related to getting back on the weights after more than 2 weeks off, and also the amount of fluids that I'm taking in on a daily basis have increased because I need to have my bladder full by 8:10 in the morning for the treatment. And that's one thing that I haven't considered in this whole thing was the amount of water I had been taking in prior to my appointment. Since switching my treatments to the mornings, I'm slamming over 90 ounces of water between 6:30 and my 8:10 appointment. And I'm then adding to that throughout the day. So it's likely the water retention is related also to what I'm going through treatment-wise. I was able to get back into the gym again for 3 days. So that's 2 weeks in a row. So I'm happy about that. In terms of my weight, I weighed in on Monday morning and I tipped the scales at 198.2 with a 19% fat measurement. So I went even further into Wonderland than what I had been experiencing in the past. And you'll find that interesting as I talk about my weight throughout the week. On Wednesday, I weighed in at 200.9 with a 19.2% fat measurement. And again, I think some of that is because of the radiation and the water retention. My water, as I mentioned earlier, my water intake is way up because I'm slamming over 90 ounces before my treatment in the morning and then continue to drink almost at a normal clip throughout the day. The weekend where I'm not getting the radiation treatment and I'm not drinking an excessive amount of fluids allows me to reset and also have some of the effects of the medication because I take my shot on Friday. So that's where I'm at my strongest on the medication. And that gets me down to a lower number by Monday morning. So I weighed in this morning at 203 flat. So that marks a loss of 1/10 of a pound from last week. And this also goes to my earlier point. I was 198.2 on Monday and 200.9 on Wednesday. So I gained 2.7 pounds from Monday to Wednesday. Then I gained another 2.1 pounds from Wednesday to Friday, which means I gained nearly 5 pounds in just 4 days. I don't think my weight is really at 203. I think my body is just reacting to what it's going through with the radiation treatment. If I had to guess, I would probably guess I'm somewhere around 199 or 200. I really don't know what my actual weight is because I'm seeing these swings for the last 3 to 4 weeks. Mondays are probably a better reflection of where I am. And the number isn't bothering me. It's the not knowing that has me a little bit concerned because I don't know if I'm going to end up closer to 190 once I finish all these treatments and able to get everything out of my system. So I'm just wondering if my dosing schedule is correct. Am I doing the right thing by continuing on a every week schedule, or should I actually be on an every other week injection schedule to make sure that I'm not continue to lose weight? Anyway, it is what it is for now. So in summary, I'm at 203 flat. I am now down 112.1 since starting my GLP-1 journey on January 12th of 2024. And that represents a 35.6% loss from my starting weight of 315.1. I'm 6'2", so my BMI is now at 26.1, down from 40.5. My scale measured my body fat at 19.4%. My blood pressure yesterday morning was 104/64. And again, I am down 155 from my highest weight of 358 in 2015. That represents a 43.3% loss from that highest weight. And so once again, thank you for checking in with me. I hope everyone has a great weekend, and I will see you in the comments.